March 2017 represents the 50th anniversary of spinal cord stimulation. My name is Bradford Noble, DO, from the Pain Management Clinic at Boone Hospital in Columbia, Missouri. I have the great pleasure and honor of introducing to you Dr. Norm Shealy, the inventor of spinal cord stimulation and the founder of pain management. Dr. Shealy, can you take a minute and tell us what gave you the idea to stimulate the spine with electricity?
Actually, it was Pat Wall, a great neurophysiologist who wrote a paper called The Gate Control of Pain. What he showed is that non-painful sensation coming into the spinal cord blocked synaptically pain coming in over the smaller fibers. Now, he was doing that peripherally by stimulating the nerve out here, but it occurred to me that maybe we could control pain over the whole body below if we stimulate the dorsal column of the spinal cord where those non-pain fibers go up.
Well, based on your experience as a neurosurgeon, why was that important? Why did you find the need to look for an alternative method for managing pain?
Because in my neurosurgical residency, we were still doing something called cordotomy, where you cut the front half of the spinal cord, which it was a very crude procedure, a very high complication rate, and didn't last permanently. And so I thought it was barbarian, actually. So I spent 3.5 years doing pain physiology. And then, at that time, Pat sent me this pre-publication article, and I went to visit him because we really didn't get all the details. And as I came out, I said, well, we ought to be able to do that, not by stimulating nerves out here, which I was already doing on the skin, but in the spinal cord. And so I did that in animals, and it worked.
And so then, I believe March 24th, 1967? 67, you went ahead and performed that procedure on a patient for the first time. Can you tell us a little bit about that experience?
This was a man who was literally moribund with metastatic cancer in his chest. And his family and he agreed, and we did it, and it totally controlled his chest pain all the way down. Unfortunately, he died of complications of his primary disease within 10 days, but his spinal cord was not damaged, and that left us feeling okay. And again, with full permission of psychiatrists and all that, interviewing the patient, we did a second patient in October of that year. This was a woman with cancer of the uterus, and her pain was controlled anytime she wasn't depressed for 7 years after her surgery.
And you had really about 500 cases by the time you completed your study group and really felt good about the technology. And I can say that I've treated thousands of patients with this procedure here at Boone Hospital and have had great success. And I thought we could take a minute and hear from a few of them, a special lady named Linda Coates and 2 United States veterans who we thank for their service, Derrick Lawson and Joseph Toepke.
Before the procedure, I had tried practically everything that is known to relieve pain. My last course of action was typically living on pain pills, which is sort of a non-life. And now I think I can honestly say 2 months after the procedure that I have at least a strong 50% less pain. Some days less, but all in all, it has given me a lot more. It has allowed me to live my life once again, and that was worth the surgery itself, and wish I had known about it sooner and done something about it sooner.
Life before was constant pain. I'd got 15 years active duty military, so my body's pretty beat up. We've gone everything from the medicines to back fusion with no help, and I literally just had this done less than an hour ago, and I'm already feeling a difference. I was able to walk from the operating room to here without any issues.
I spent 23 years in the military. I flew helicopters, did all kinds of stuff. Just insane back problems ever since being in Iraq. Came back, did spinal injections, opiates, everything, chiropractic, not any sustainable relief. And I remember the first night of my trial, I went home and I could sleep through the entire night without having to get up and roll around and doing everything. It has definitely made a tremendous impact on my life.
Well, Dr. Shealy, thank you so much for helping the lives of millions of people with this technology. I just can't thank you enough. You've made such a huge impact in the world, and we all owe you a debt of gratitude. If you or a loved one are suffering from pain and you'd like to set up an appointment at the Boone Hospital Pain Management Clinic, please give us a call at 573-815-2700, and we can help.